So today we're going to talk about male urinary incontinence. So can you tell us a little bit about the continence mechanism in men?
Yeah, so it's actually quite interesting. I just find it that many people, they think simply squeezing the waterworks or the bladder, that's what make them continent basically. But it's more than that. It's basically like a teamwork. You need a good nerve supply, like a wiring, good wire, just to kind of supply all the muscle that's related to it. And the way it works, basically, if you think about it, it's more like a pressure. So once your bladder gets filled with the urine, the pressure around the water pipe is more, so to keep everything in place and also to allow the bladder to fill with the urine as well. But when the opposite happens, when the pressure more in the bladder, then that's open up the water pipe, and then you have that flow of the urine. So you got nerve supply that you can have control for as well, and then the sphincters which keep everything sealed. So it's like a coordination between your bladder, between your water pipe, and also with the most underrated player here, it's actually the pelvic floor muscle. It's underneath all this important structure, and it keep everything in place, because anything kind of misalignment, it lead to disturb this mechanism basically.
And can you explain a little bit about why this is potentially an increasing problem for men today?
Yeah, actually, as a urologist, we started to see this condition more and more actually. As you are aware that the prostate cancer is the most common cancer in UK. So it's basically, and the management of this prostate cancer is either to remove the prostate and then plumbing basically the rest of the water pipe with the bladder, or give a radiotherapy. So both these treatment has a really side effect and mainly impact this continent mechanism. This is why we started to see it more and more.
And what role can pelvic floor physio play in this scenario?
Yeah, so it's really important, especially in elderly men, as basically it's one of the major element in keeping you continent, because it supports the whole structure there. So if it's weak, which usually happen with age, and with any treatment as well, like a radiotherapy, usually kind of that. So if that happen, then it get basically more weaker, and that disturb the mechanism. This is why any guidance from us or from the European always recommend physiotherapy. And in some situations, we start that early on before the treatment, and we find it patient get drier very, very quickly.